Good afternoon, everyone. My name is Amanda Bingman, and I am the Administrative Coordinator for the American Alliance of Orthopedic Executives. Thank you for joining us for today's webinar. I have a few housekeeping notes to review, and then we'll get started with the presentation. First of all, participants have audio access only during the webinar, so that means you're able to listen to the presenters, but you can't speak to them or to other attendees. However, your questions are absolutely welcome in this webinar. If you have any questions, go ahead and type them in the chat box on the right side of your screen. Our speaker will take time to address the questions at the end of the presentation. You can feel free to type them as you think of them. The webinar will be uploaded to the AAOE Live Learning Center within 1 week for you to download and listen to again or to share with other staff. There's also a link to the handouts for this presentation in the handout drop-down menu, and you will also be able to find those in the Live Learning Center when the recording is uploaded. And also, in an effort to continuously improve our education, please participate in the survey that will be available following the webinar. I'd also like to take a moment to thank Vanguard Communications. Their sponsorship is vital to ensuring AAOE continues to bring members free, high-quality educational offerings. And with that, I'll introduce our presenter. Our presenter today is Harman King, CEO of Vanguard Communications Healthcare Marketing and Practice Improvement. Vanguard is a dual-discipline firm specializing in both digital marketing for private and academic medical practices and in process improvement for practice operations. Ron founded Vanguard in 1994, and the firm has since worked with practices in 17 specialties coast to coast. Today's Ron's presentation focuses on what the internet reveals about patients' true needs and wants, and some easy ways for healthcare provider groups to improve patient experiences and satisfaction. And with that introduction, I'll now turn it over to Ron.
Well, good afternoon, everybody in the Eastern time zone, and good morning to everyone else in the other 3 zones. And I'm in one of those. I'm in Denver, Colorado. And I know we're giving you a free webinar today, but I'm going to do my best to try to give you $1 million worth of information here. So today we're going to cover 5 areas, and this has evolved a little bit from the original title, so bear with me. I'm going to cover the topics of the original subtitle, I should say, but I want to add some new information into that as well. So we've got 5 areas here. We want to find out a little bit about what people say about healthcare providers, mainly in online reviews, because that's where a lot of our work is done these days, is in researching patients' needs and wants as expressed in online reviews. And then we're going to talk about how that compares to more formal surveys, such as the HCAP surveys. And then we'll cover a few more items about the internet, what we can learn from it, and apply it to private practices and other practices as well. And then I want to talk about something that's called the water pitcher principle, and I'm going to just introduce this concept today. And a little tease, I'll be talking about it a little more in depth in the 2018 AAOE annual meeting in Orlando. And then lastly, of course, we'll talk about how to apply it to practices. So a little bit about us. Basically, we've been around for 23 years, and we think of ourselves as a healthcare uniform. We started as a marketing company, and what we found out was that quite a few years into this work of bringing new patients to clients, we found that they were having trouble handling the increase in new business, and so we've since started a new arm of our firm that helps practices become more efficient so they can actually handle more patients. Our work is largely research-driven. As I mentioned earlier, we spend a lot of resources on trying to learn the internet and patient needs as expressed on the internet better. And we've been doing this long enough now that we actually guarantee all our clients that we will increase their business and in combination with cost savings by a factor of 20 to 35% in the first year, or we will work for free. And we've never had to work for free. We've always met our goal. So as Amanda mentioned, we've worked with practices in 17 specialties nationwide, coast to coast. And we've learned quite a bit over the years, and we haven't learned it all yet, but hopefully we're well on our way of getting there. We basically have 2 programs. MedMarket Link is the marketing program, and Metamorphosis is the practice improvement program. Okay, enough about us. This is how we became a unicorn, as I mentioned. We keep finding that practices need help really getting more patients through their doors, and so that's the metamorphosis part. So on to what patients really want as we see on the internet. First of all, I don't need to show you this graph to tell you what you already know, which is that the internet has just exploded in the 17 years since the century began. But it is rather sobering to see the growth in use of the internet plus broadband access as well as social media, smartphones, and so on. Last year on our clients' websites, which we develop and manage for them, 65% of all the visits were to those websites were on smartphones. So smartphones are becoming the device now for health information access. This is great information that the Pew Research Center regularly publishes that really proves how much internet plays a role in our life, particularly in health care. 4 out of 5 of all healthcare consumers or all internet users have looked online for health information in the last 12 months. And it's even higher for college graduates. 84% of those people gather healthcare information online. We like that number because these tend to be the higher income, better educated, better insured people, and that's good business for practices to aim for. And even those people who we think are not internet savvy and are disconnected often have loved ones who are working on their behalf to learn about their needs and how to fill them for their loved ones. So 30% of people who are on the internet are helping loved ones with personal chores. So this idea that grandma is too old to use the internet is rapidly becoming not particularly applicable anymore, because grandma sure enough has somebody in her family who is helping her with internet research. This was a study we did last year in 2016 of online reviews, which we find extremely interesting. We looked at 34,748, nearly 35,000 online reviews on various Rate Your Doctor websites. And this was the stunning finding. 96% of the 1- and 2-star reviews of healthcare providers were service related, customer service related. Half of them were, more than half, were over poor communications. About a third, of course, no surprise here, were long waits. And of course, 12% were some complaints about practice staff, and only 2% were about billing. Less than 4% are about quality of care. I think it's very difficult for the average healthcare consumer to really evaluate the quality of care. We have to, as patients, really trust that we've picked the right care providers, and otherwise the only thing we can really judge very well is what happens around the quality of care, and that is the customer service. So this is a question that everybody raises, these two questions here. Aren't online reviews, one question with two assumptions underlying them. Aren't online reviews unreliable? That's a really good question, and an assumption I had for years too. And it's based on two myths: that complainers are a lot more likely to post online reviews than happy customers or patients. And by the way, I see patients as customers today in our relatively free market healthcare system. A lot of physicians don't like to use that word, but I think it's very applicable from a business standpoint. The second myth is, of course, reviews aren't representative of all customer patients. You don't really get a scientific sample that represents the entire range. And here's what we found. In our study last year, by a factor of 2 to 1, patients give healthcare providers 4 or 5 stars in their reviews, that they give them the highest ratings. Less than half, right around 34%, give them 1 or 2 stars. And even more interesting, the 5-star reviews account for 69% of the words written about providers in these Rate Your Doctor website reviews. Less than a third of the content is actually in 1 and 2-star reviews. So not only do patients praise doctors twice as often as they criticize them in Rate Your Doctor websites, but they write a lot more about them when they're happy. A very sobering thought for me. We also have looked at some research that I find most interesting. I consider this a seminal study. It was done by a medical student, I believe in 2015, published in 2016, and he and his colleagues went through a very rigorous research project looking at Yelp reviews in comparison to HCAP surveys. And what he found was, or what the team of researchers found, was that any hospital with 3 or more Yelp reviews have ratings that roughly correlate with HCAP surveys. And not only that, but you actually get more information out of the Yelp reviews. So they cover far more topics. Whereas the majority of topics that posters and reviewers make on that website are not actually covered by HCAP. So it's kind of a shock to me that HCAPs may not be as good in some respects, an indicator of the degree of patient satisfaction as Yelp. So those two slides here say to me that the myths that we assume often about online reviews are not necessarily true. And this is my major point. Yelp and websites like it, but particularly Yelp, is just too big to ignore. It's really hard to say that we can afford to forget about Yelp because it has too much influence now in all businesses. It's frankly where I personally go for a lot of my needs, service needs, healthcare, household, and so on. So I say to everybody, we may not like a lot of the realities and the things we read that are written about us and our businesses on Yelp, but we can't ignore it. This is another fact I think is very important to keep in mind in orthopedics and in every other specialty, and that is people are online much more to look for health information than they are to look for healthcare providers. If you are familiar with Google Analytics, it's a software system for actually measuring website activity. This is one of our clients' websites. It's an orthopedic practice. And when you look at this chart here, this shows you the order of the most visited pages in a month's period on this website. Number one is a page of information about hand conditions. Number two, the blank with the blanks space there with nothing after it, with a slash with nothing after it, is the home page. And then the third most popular page is a page on foot and ankle conditions. Fourth most popular page is a page about nerve damage and conditions on that website, and so on. The doctor's page is eighth. So this really shows that they're only getting about 1,000 visits per month to that page to find out about doctors, whereas one page alone on hand conditions is getting nearly 10 times that much. And then when you add all the other pages together above number 8 there, it grows even more dramatically. So I think that's a very important point to keep in mind, that patients look on the internet for healthcare information first and healthcare providers second. I'm going to address this more here in a minute. So let's talk about the water pitcher principle. This is something we've developed here as a concept at Vanguard, and it's based on this idea. If you spend any time on Yelp or some of the other websites, particularly those in the travel business like Trivago or Travel Advisor, you'll see quite a few reviews that are very much oriented, reviews of restaurants, I should say, that are very much oriented around not just the quality of food, but the quality of the service. And here is a typical Yelp review I pulled off the internet about one of the restaurants here locally in Denver. And the reviewer said that the food was really good, really off the chart good, but it could not give the place more than 3 stars because service was that bad. This is a French-themed restaurant, and this was another review I found most interesting. This is verbatim what the reviewer said. Excellent service, amazing food, awesome French ambiance, relatively affordable food, great valet parking, but they didn't like the complimentary water, and they were saying they need to use filtered water rather than tap water. I think this very definitely falls into the category of the fussy customer, and I'm sure you've all had patients who can't be pleased just as much as this person couldn't either. But still, both of these reviews are not uncommon, and I think they really underscore what we're thinking here all the time, which is the first and last impressions in any service business, including healthcare, are the most important. And in a restaurant, a strong indicator of the quality of the overall restaurant experience is, did somebody keep your water glass filled? I was experiencing this myself recently at a restaurant when someone said they would like to see the waiter with the carafe a little more often. It really is impacting the enjoyability of the meal. And that's important here in arid climates like Denver and elsewhere, but I think it's kind of everyone's mindset. So the equivalent of this in healthcare is that you can have fantastic health care, quality of care, but if you have mediocre service, as we've seen, in our research, that usually spells trouble for providers in terms of their online reputation. And patients generally want and expect the same level of service from doctors, clinics, and hospitals as they do from other businesses, service businesses, restaurant stores, hotels, and car dealers. So especially in healthcare, I think communication is the real most important component of great service. So let's dwell on this for a little bit. What we found in our survey of those nearly 35,000 reviews is that even a great doctor cannot succeed in a poor service environment. We found that in the 5-star reviews of healthcare providers, 40% of the reviewers praise bedside manner, but only in 1-star reviews, the reviewers rarely or never do. So let's apply this to healthcare for a little bit. How do we keep our patients' pictures full? And I've got 4 fairly easy actions, but I'm going to talk about some real practical stuff here. With some realities and some wide-eyed acknowledgement of those realities. And one of them is there's a lot of talk these days about the patient experience and how to improve it. And I find it rather distressing that a lot of that is around what the doctor's doing. Whereas I think so much more can be at the typical practice these days with the people around the doctor. It's not really the doctor's job by any means by himself or herself. You know, filling water pitchers, metaphorically, should be a team sport. And I think one thing that would really cheer physicians who are already getting more harried and frenzied every day with the increasing pressures on their job is to tell them that there's going to be a new day of patient satisfaction. It's going to be teamwork oriented. So that might really spur morale in your group to start with, and it may actually lead you down the road much faster to improving the patient experience if you're interested in doing that, and I hope you are. So we break the patient experience down into 4 phases with particular emphasis on the last 2. The first one is the first introduction to practices these days is increasingly on the internet. We call that the eye contact. Then people typically will call at some point before they make the visit. In many cases, people will ask and book appointments on a practice's website. But I think the majority of patients still these days talk to someone at a practice before they first come as a new patient. Then phase 3 is the warm welcome. This is where patients are actually greeted on their first visit. And then, of course, the last phase is the longest and the most complex, and that's the continuing journey of care. Today, we're going to dwell only on the first 2 phases. I will touch on phases 3 and 4, but I want to give you some ideas about what we see as enormous opportunity for improvement in most practices, and that's the eye contact and the first touch. So brace yourself. We're going to talk a lot about the telephone, and some of this may seem like rather obvious observations, but I want to say that the telephone is still the largest problem that I see in customer satisfaction in healthcare. So we're going to spend a lot of time on that. But let's talk about the eye contact first. I am in the business, obviously, of being a digital marketer and communicator, so I'm biased here, but there is unbiased, independent research that shows that the first contact more and more that patients have with health providers is through some kind of research online, whether it's through visiting providers' websites, going to directories like TopDoc or ZocDoc or one of those, or in many cases they learn about them on social media more and more. So the question I think every practice should ask itself is, what can prospective patients learn online without calling? Because these days people are shopping for providers before they book appointments. And the more you can tell them about what insurance coverage you accept, where your clinic locations are, even physician availabilities and online appointment request forms, the more comfortable I think new patients will be in booking appointments with your practice. So one of the things we do is we make it really easy for people not only to find our clients online, but we also make it easy for them to reach out to those people. And we do that in a variety of ways. One of the best, of course, is to have those online appointment requests, which I just refer to, and that is the example I'm showing the upper right-hand corner here. We also have, for some of our clients, what we call online doctor's corners, which is a page on a website for each physician in which a visitor to that page can actually click a box or button that says contact the doctor online, and that opens up a encrypted form which that person, that website visitor, can then ask a question of that physician. Now, a lot of physicians don't want to be bothered with this, but those who do often have those questions fielded by medical assistants, and it's quite effective in building trust in a relationship with the prospective patient before they've actually asked for an appointment. So the third way is that is very common for us these days is we can actually respond to people now through Facebook and other social media platforms. So you can go to a page on Facebook from your orthopedic specialist, for example, and post a message there, and we can respond to that. Now, there's lots of privacy and HIPAA issues to be aware of here. That's a discussion for another day. But remember that as long as you don't discuss a patient's individual health or health history, and you talk generally about the practice and what you do, even if it's public, you are probably on fairly safe ground in terms of patient privacy. So making it really easy for patients to learn more online and then respond to what they learn, and then having a prompt response when you do get those inquiries, I think is a great way to begin building a relationship of trust with patients on the internet. Sort of a next step up is to help actually cut your routine phone calls volume down a little bit by providing a page on a website of frequently asked questions. You know, poll the front desk on what are the 10 most questions they get on the telephone and post those answers on the website on a FAQ page, and it does wonders for improving efficiencies there. The next step up, which I think is really effective in earning the trust of patients, is to tell patient stories. People want to believe doctors, but they will believe other patients very readily. So we spend a lot of time here interviewing patients of our clients and then writing their stories and posting them to the websites. And it demonstrates a lot of empathy and builds trust, because then the patient understands that you are focused on him or her rather than on the providers. We've had some terrific success with these. When you look at Google Analytics, we can see that some of these pages are the most popular ones on the websites, and who wouldn't want to read about a cute little girl like this whose arm was saved by an orthopedic surgeon. And then the best of all is also the most time-consuming and the most expensive in terms of resources, which is to provide basically a health library online on your website, which you can also branch off of and use for social media postings about orthopedic conditions and treatments. If you can provide this information on the website, then I can guarantee you will have much more visits on your websites and ultimately more feed through your doors. We see that when we do this for clients, the search engine rankings for certain search terms rise dramatically for our clients' websites. That generates more website visits, and again, that generates more new patient visits, and in the end, it also saves your providers some time in the exam rooms explaining some of the basics, and they and others in the practice can refer to this information online regularly as an ongoing resource. To the right is, by the way, the website traffic chart over time for one of our orthopedic clients, and you can see the curve is generally upward. At the time we took this snapshot, this practice was getting, I think, about 14,000 visits per month to their website. Today it's over 40,000. So that's the kind of eyeball and exposure you can build through having a good healthcare library on a website. So now let's move on to the cursed telephone, and that's usually the first touch, the first human touch between patient and a provider group. And it's always, in my view, the biggest choke point of just about every practice. So I want to talk about how to remove those obstacles in that choke point, and see what happens in your online reputation especially, but also in patient trust in general. I really believe that the measure of a great provider group is the level of the telephone service it gives, and I really advocate for white glove telephone service. The problem is, in healthcare, that job is usually taken by the person with the least experience and one of the lowest compensation scales in the practice. And I think this is a big mistake, because in many cases those people are not motivated in the right way, and they are moving on to another position sooner or later. And for that reason, there are many problems, including not getting back to patients in a timely way, whether they're a new patient inquiry or an existing patient. I think that really costs the practice in many ways. I have a kind of a guru I look to for telephone advice, and it's a practicing urologist in New Orleans. He's pretty well known. Neil Baum is his name. He actually works with us here at Vanguard. He's not only a urologist, but he's an author of 7 books, and he speaks publicly all over the country, and he's a magician, and he works magic into his speeches about healthcare marketing and management, and for that reason he calls himself the Wiz, which is a great nickname for a urologist. And his view is that the telephone is opportunity, and it should be treated as such by any healthcare provider group. So his, oops, I went the wrong way, my apologies. His view is that there should be no phone tree, that every practice phone should be answered by a human. He says trees are for acorns and fruit, not for communicating with patients, and I agree. But I think today the majority of practices still use phone trees. But I want to give you 6 of his tips here. This is him performing magic at a wedding, and he wanted me to tell everybody that he's available for weddings, bar mitzvahs, and graduation parties. So his 6 tips are to hire only receptionists who can answer with a smile, and he actually has his receptionists place mirrors by their workstation so they can look at themselves as they're speaking to the phone. And if they have the right facial expression, it will come across in the phone conversation. He has a rule in his practice that you answer the phone within 3 rings, and the receptionist identify the practice and time of day. Good afternoon, this is Dr. Baum's office. That's a good warm start right off the bat. I wanted to show the other side of this slide so you could see the bemused look on the wedding guests' faces there. The receptionists in his practice also identify themselves immediately, and they offer help immediately. How can I help you today? And they ask for and use each caller's name at least twice during the conversation, which I think is a terrific way to make an instant connection with every caller. You already feel that you have a patient-physician relationship blossoming from just that. So, so much about this, though, is getting the right people in the right places with the right job opportunities and the right role responsibilities. What we find in many practices is not that people don't want to really do a good job, it's that they're not empowered to do a good job. And that's really all about sort of rethinking your whole culture and not just hiring the right people, but getting the right people the right responsibilities to handle. So we'll just touch on phases 3 and 4, which are the warm welcome and the continuing journey of care. That's a much more complex area, but I want to say that what we do now in our practice improvement engagements is we actually help practices form a patient experience task force, and that's made of frontline and clinical staff who are empowered just by being asked to serve on this task force. And then we charge them really with the role of leading the practice into a new culture of improved patient experience. And their duties are quite formidable. They are charged with evaluating all internal touch points inside the practice from the patient's point of view in terms of are they delivering the best service they could. Then they're charged with designing and scheduling a 6-month bridge building process with milestones and deadlines for improving those touch points from the patient's point of view, of course. And they must do that by having the regular task force meetings with milestones and responsibilities to fulfill for each meeting. And then over time, they are also charged with identifying and monitoring and charting data that supports their progress in improving the patient experience. All that's a pretty complex deal, and just selecting the data and monitoring it can be a complicated job. So I'm not going to go too far into that today. I will address that in much more detail in Orlando next April, and I hope to see at least some of you there. So I want to move on to the hardest part, and that is based on our observations and experiences here, and that's getting this person on board. Physicians are, and this is straight from the mouth of Dr. Baum, who's one himself, are creatures of comfort, and they are comfortable with the status quo. They're sometimes the last to embrace cultural change, and I see where their training and education actually, in a very good way, teaches them that, because we don't want to rush into conclusions early in medicine. We could actually harm people if we do that. However, the business and operational side of medicine is another world unto itself. So I think change is absolutely essential in every business, and ongoing change is essential. So nonetheless, they may be quite resistant to the concept of empowering frontline staff, because doctors, let's face it, do pretty much like to be in charge as a whole, with good reason. So you're going to have to set expectations anytime you want to change culture and realign it a little better towards patient expectations and patient experience. And that is by laying the groundwork in saying that success will take time. You have to really get the physicians used to the idea that good patient health and good patient satisfaction and good customer service is a incremental process, just like good health can be. You don't get fit and in good health overnight if you've not had good health habits to start with. You also can allay many fears by telling them this is going to be a very data-driven process. You want to benchmark everything you can and monitor any changes in it. And some of the benchmark examples that we use is we can actually see how many people are not staying on the phone long enough when they call the practice to get their call answered. We can see how long the call wait time is. We very much watch new patient visits as an indicator of how successful the practice is in its business growth. Website visits, appointment requests are very, very good indicators of progress, and just general access to care as well. If the task force reports those results and changes to docs regularly, I can guarantee you can win them over. And I'll give you a couple of examples here of where this happened in a very impressive way. This is a medical center we work with, 3 primary care and 6 specialty clinics. Within weeks, we were able to reduce the unprepared patient turn-away rate from 10% to 2% of the visits. Call abandonment rate dropped from 26% to almost nothing. The call wait time dropped from 290 seconds to 73 seconds. Just an astounding cut in weeks' time. And there was a 60% reduction in new patient registration time. All very, very impressive improvements in process and efficiencies. In the same center, we had a 72% reduction in the time it took for the patient to get from the reception to the exam room, 9% increase in same-day copay collection, so they were taking in more money as a result of this, and the patient satisfaction improved from 39% of people clicking the top box for the most satisfied to 83%. And overall, within a year and a half, they were able to handle 54% more patients. That one is the deal sealer to me. 54% increase in patients because of improved efficiencies. This is what can happen when you can align your culture around better patient service. So this brings me to the end. Why do we go to work every day? It's to help people feel better. Quite honestly, that's what we do here at Vanguard Communications too. We are really advocates for patients. We want to help give them what they need and want, at least the reasonable ones. And we really try to do our best on behalf of our clients to give every patient a 5-star experience. And are pleased to see many more practices and healthcare provider groups really aligning in the same way. So this brings me to the end. We're going to have a little Q&A for any questions we might have. I do want to point out a couple of resources in partial self-interest here. I am a regular video blogger on MedPage Today, which is a CME website that reaches something like 70% of all U.S. Um, physicians, and I'm in a section of the website called Practice Management. So I have, at this point, I think close to 24 videos on there. I encourage you to go to that website, check it out. Hopefully you'll find something of interest that I've said in those videos. Also, we have an online professional education center on our website that we call the Wired Practice, which is at that address there. So that brings me to the end of the presentation. I'm very happy to take some questions, and I have here with me Amy Lube, who is a colleague of mine and works in the metamorphosis section of our firm, which is the practice improvement section, and I'm going to ask her to field any questions, to read them, and I hope she'll help me answer some.
Absolutely. Good morning, everyone, or afternoon. Okay. Do we want to start at the top?
I think so.
Okay, so you make it sound so easy. What about small practices that just don't have the staff to answer phones every time they ring?
It's a great question. I hear that a lot. We just can't afford to dedicate the people we need to do this right. Well, I say you don't really know if you can afford it, because until you try it, you don't know what costs you've been paying already not to have that. So often, when people dedicate the right resources, it's not a matter of getting more people in or hiring more employees. It's often a matter of just realigning job responsibilities. And when you do that, you may be surprised at how you can do more with the same people you have. And I also want to say, I resist this idea that you can't afford to have good service. It should be a standard expense that everybody's ready to make to answer the phone well. I mean, the phone is the lifeline to your customer base, your patient base out there, and you've got to find a way somehow to marshal those resources for that point. And in the end, if you do this well and do it right, I believe you'll find that it will not only not cost you more, it will actually save you more.
Okay. Next one. What kind of phone system will let me gather data on call abandonment rates and how many rings before calls are answered?
That's more a question for you, Amy. You're the phone expert.
So I think in any system, even if you've done something through like a Comcast or anything like that, every system's going to have some sort of data collection. It's just getting to the right person. If you're in a bigger system, it's going to be you're going to be assigned a telecom person, and they all have reporting aspects. So you should be able to get some sort of general call volume, abandonment rate. So when we talk about abandonment rate, these are people who enter your system and either get frustrated that they haven't gotten to a person, or they've been on hold for so long that they hang up. So those are very important things to know, and I think it links back to the first one about not knowing if you actually have the staff to do that. Because if you find that you're getting 100 calls a day and then find that your abandonment rate is 20%, a lot of those people are hanging up. So how can you better answer them the first time, and you won't be getting 100 calls a day? So no, I find that people just don't know their phone system data as well as they know their volume of people walking through the door, and I feel it is just as important. So you just have to find the person answering it. If you have I see most healthcare systems have, a Cisco system, they have a reporting system. You bought that phone system with a reporting system, so just hound telecom to give you the right answers. Okay, next question is, it would be nice to have a lot of detailed information on our website about orthopedic injuries and disease. Where do I get it? I can't imagine asking my doctors to take the time to contribute anything.
That is a great question. It's really hard to do this for small practices especially. Okay, I'll do the easy part of this answer first. For larger practices that do have some sort of a marketing or public outreach budget, I say devote some portion of that budget to finding a good freelance writer or a firm like ours, or somebody who is more in the content marketing field these days. And there's plenty of people out there who do this now, because content marketing is getting to be the big thing. Content marketing means information published on the web, basically. And there are a lot of specialists who are skilled in this, particularly in healthcare, and contract that person or firm or what have you to devoting some resources to uploading some of the basic, to writing original content, by the way, because if you copy from anybody else, you not only face copyright issues and plagiarism potentially accusations, but you also risk what's called duplicate content, which Google now has algorithms in their search engine software to spot, and they can penalize or even take you off their listing so that you don't show up in web or in internet searches whatsoever. So it's important to have original content that somebody wrote, and that's easier when you have a larger practice with the financial resources to do. There are a couple of other options for smaller practices who aren't so well financed. You can convince doctors to often to work with you to do that. What happens, though, I find, is that physicians have great intentions, but they just never quite get to it because they're already working 60, 70-hour weeks and so on, and their enthusiasm often isn't very high for this. A third option is suboptimal, but it can be effective, and that is you can actually lease content. There are a number of companies who are in the business of supplying content for your website, for medical practice websites that are health libraries and very consumer-centric. The only disadvantage is you pay a monthly fee for that, and you don't actually own the content. You're just renting it, basically. And also, it's not really counted as part of your website. It's resold on other websites, and you don't get credit for it in the Google search engines. But at least you have something to show patients and prospective patients in terms of good healthcare information. In many cases, these companies actually only sell you a link for you to link your website to theirs with the health library on their own website. Either way, you've got basically three options here, depending on the size of your practice and how much you are able to afford.
Okay, next one. Right now we have more patients than we can possibly handle. What do I do to make the phone stop ringing?
Well, that's a good question. First, my response first is a question back. Do you want to do that? I think this is partly a tongue-in-cheek question, but I would say that if you're in that fortunate position, it's time to really do your task force and to look at why you can't handle the influx of calls. Now, granted, there are many complexities in this. Not everybody wants every patient, and in many parts of the country, the payer mix is not what it should be for practices, and they would like to have the phone ring with the more commercially insured patients and so on. So, all that aside, my sense is that no matter what your situation is financially and in terms of having enough providers or not, you still want to work on a phone system that works for anyone who calls. And I think that gets back to the idea of realigning job responsibilities in a practice so that you have the right people with the right responsibilities answering every call. Otherwise, it's not a very expensive investment. Otherwise, you risk making existing patients unhappy and alienating prospective new patients that you would like to have at some point in the future anyway. Remember, right now we're at record high employment in the United States, and coincidentally at record high healthcare insurance. So there's kind of a cornucopia now. That may change. It will change eventually. There's going to be another recession. There'll be more people out of work, fewer people insured. Who knows what's going to happen with healthcare reform? So if you're having a great year or a great 3 years now, it could change in the next 5 years, and you want to be ready for hungrier times by having the right kind of customer service, including a great telephone communications capability.
And I think I'll just add to that a little bit, Ron, because you touched on the tasking portion, is that usually the tasking of your administration staff is not equally level. So you may think having everyone on the phones and having them answer the phones is the way to go, and you're still not servicing the customer or patient well, or so do minimizing people on the phones and giving them that direct task help you alleviate that. So just looking at who does what specifically, not job titles, but what they do on a day-to-day basis, and how can you level that out a little bit more. Okay, the last question we have right now, and Ron, you started to touch on this, with unemployment at record lows, it's no easy task to find replacements for staff who leave for other jobs. Employees seem to have less loyalty in boom times. How do I convince physician shareholders that empowering lower-level staff isn't letting the inmates run the asylum?
Well, that's a wonderful point. In my many years of working with physicians, I find that quite a few of them they're more interested, I think, in saving money sometimes than making money. And we all know as business people, to make money, you have to spend money. So I think starting with that premise is a great way. But I also feel that it's not entirely a question of cost and economics. In fact, it may be that costs and money are less of an issue. There have been quite a few surveys over the years that show that what motivates people as employees is not so much how much money they're making, but the level of their job satisfaction. And this is why I believe, actually, that patient satisfaction is really all about employee satisfaction. In my many years as being an employer, I found that when you give people a very clear job description and the responsibilities with the authority to enact those responsibilities, and you create a good work environment, they will stick with you more often than not. People leave not just for more money, but they often leave, probably more often, in fact, for other reasons. They're not enjoying their job. They find the work environment unpleasant. They struggle with office politics, with turf issues, and all that sort of thing. It is possible, I really believe, for every organization to resolve those problems, to make it a happier, healthier, more productive place to work. And in the end, that's what humans really want. Certainly, they want to make a living. They want to make a good living at it, but that's not always the #1 priority for them. So I think the way to get at this with physicians is to first talk about the investment in the business, which will see a return. Ultimately, just takes time. And secondly, about getting their support for building a more productive, efficient operation, which is not an immediate result. It really takes a lot of agony and effort and some angst to do. But you have to have everybody focused on that from the bottom to the top of the hierarchy. That's my best answer. It's a long, slow conversation with doctors, as many things are. I think physicians tend to be, rightly so, very data-driven, and I try to work very hard to gather the right data to underscore these things. That some of this is intuition and assumptions, but a lot of it really can be measured in numbers. And one way to do this, by the way, is to conduct regular anonymous employee surveys. You can do this online now with SurveyMonkey and some of the other softwares. You can really get a good read on what people are feeling about working for you this way, and use that as some of your soft data in presenting to physicians and helping get their support. We're approaching the top of the hour. If we have any other questions, please get them to us now in the next few seconds. Otherwise, I think we're reaching the end here, and I do encourage you to take a look at MedPage Today. It's a great website, not just for my own reasons, but I find it extremely comprehensive, covering all specialties. It has really some great experts weighing in, quite a few physician video bloggers whose pieces I find interesting, and it's very newsworthy and timely. I read it every day, several times a day, and I really recommend it for everybody else as well. And of course, I can't not recommend our own website, which has quite a bit of information designed for the medical practice manager and administrator. Sounds like that's probably it for questions from the audience. Thank you for listening today, and I appreciate your interest and attention, and would love to hear from you if you have any follow-up questions or comments, and look forward to seeing everybody in Orlando in April 2018.
Great. Thank you, Ron, for presenting today, and thank you to everyone who attended today's webinar and asked questions. I want to invite you all to check out our future webinars. Our upcoming webinars include a hot topic webinar on November 2nd, and that's on 5 key relationships you should develop to support practice growth. And then on Thursday, November 30th, we have a peer-to-peer webinar on the 2018 CPT, CMS, and NCCI coding updates for orthopedic surgeons. You can check out our webinar calendar on the AAOE website for more information and for more upcoming webinars. And for more information about AAOE, or if you have any questions, you can also email info@aaoe.net. Thank you again to Vanguard Communications, and thank you again to everyone who took time out of their day today to learn with AAOE.